Hello, my name is Dr. Chris Mecoli, and I'm a rheumatologist in the Division of Rheumatology here in Baltimore, Maryland. My main areas of interest are two rare conditions. One is inflammatory myositis, the other is scleroderma, otherwise known as systemic sclerosis. Within these diagnoses, there are conditions such as dermatomyositis, polymyositis, necrotizing myopathies, as well as various forms of scleroderma like linear and localized that I specialize in. Rheumatology was always one of the most interesting fields as I was training in medicine. Many doctors were unfamiliar with the diagnoses and weren't sure how to diagnose and treat them, and that interested me. I also liked the continuity of care that the specialty provided. Building relationships with patients over many years is something that was very appealing to me. So, being part of two different centers, I have two themes of my research. In the myositis realm, one of my main interests is the relationship between cancer and myositis itself. So there are a lot of uncertainties as to which patients are at increased risk for cancer, how we should go about evaluating them, and for how long we should really screen them for cancer. So some of those questions are what we're trying to answer in my research. We're also looking at what are called patient-reported outcome measures. These are basically things that are important to patients that we measure in both our clinical studies as well as clinical trials to get a better sense of the disease. My research interest in scleroderma, similar to that of myositis, also involved cancer and about studying the best ways of screening patients for cancer who have scleroderma. In addition, we also have a lot of interest in what are called vascular outcomes of scleroderma, meaning digital ulcers, commonly of the fingertips, as well as pulmonary hypertension, which is high blood pressures in the lung circulation. We're looking at better ways of predicting these complications, which will hopefully lead to better ways of treating them. I think now more than ever, specifically at Johns Hopkins, we have a capability of performing multi-center studies, meaning we are partnering with a lot of other institutions to really pool our data together to study these diseases, which is really important given the rarity of all these conditions. It helps to be one of the largest centers in the world, but really it helps even more to partner with other institutions to increase that number further.